I am Eileen Doherty, and I'm the director of the Colorado Gerontological Society. And I would like to welcome you to our Aging in Place series this afternoon. We have been doing these for probably the last 6 or 7 months, and we have them scheduled throughout the rest of this year and well into 2022. What we've been trying to do with this series is to really begin to look at a very specific level, specific topics that will enable you as an older adult to continue to live in your own home. So today, our plan is to talk a little bit about Medicare benefits that allow you or help you to stay in your own home. Medicare does not routinely cover a lot of services, but the ones that they cover are very significant. So we'll be talking a little bit about durable medical equipment, about hospice and home health benefits, about programs that can help you with these costs, and how that can help you. So just so you have a little bit of background information, Medicare has 4 parts. So it's Part A, B, C, and D. And Part A is hospital and inpatient benefits with a little bit of home care services, as well as the entire hospice benefit is part of the home care benefit that we'll be talking about. Part B is usually we think of Part B as the benefits for like doctor's visits, home labs, x-rays. But the other thing that's included in Part B is durable medical equipment, prosthetics, orthotics, and various kinds of supplies. Medicare Advantage plans are the Part C, and that is where the Medicare Advantage basically provides your A and B coverage, as well as most of the plans also incorporate your D coverage. And then there are some additional benefits that some of the plans offer as well. And then Part D is prescription drug benefits. If anyone is interested in more in-depth conversation about any parts of Medicare, we are doing some Medicare programs over the next few weeks. They're also on our YouTube channel, and I'd invite you to go to our website to check out our Medicare Monday and our Wednesday Lunch and Learn programs. If you need help and you aren't able to dial in on Zoom, or you can't get it through YouTube, please feel free to call us and we'll send you some hard copy or give you the information to dial in. So one of the things that we also want to look at here is how do we reduce the out-of-pocket costs with Medicare? So Medicare Part C plans, or the Medicare Advantages, have their own deductibles and copays. And sometimes they do offer additional services. They do, there's a lot of oftentimes 20% copays for a Medicare Advantage plan, but then depending on the plan, there is a cap. In 2021, the cap for out-of-pocket expenses for Medicare Part C is $6,700. That will raise in 2022, and I believe the cap is something like $7,500. Medicare supplement insurance, basically, usually if Medicare pays, then the supplement will pay as well. So if Medicare pays for an outpatient service at the hospital, if they pay for a physician visit, if they pay for a lab, then whatever the copay is, then the Medicare supplement usually pays. Sometimes people also have a third-party employer or retiree or military insurance. This could be people who are retirees from, say, the Denver Public Schools or from the government. It could also be people who either spent 20 years in the military and they have TRICARE, or it could be individuals who were in the military, not for 20 years, but served for like 2 years or 4 years. They may also be eligible for VA services. This particular presentation is not going to cover any out-of-pocket costs that might be covered through those payer sources, because those really do vary. The last type of out-of-pocket costs that sometimes people are able to take advantage of is Medicaid. This is a program that we did do a session on, and you can find it on our website as well as on our YouTube channel. It's included in the unskilled services discussion that we talked about last month in terms of aging in place. So you become eligible for Medicare when you turn 65, or if you've been on Social Security disability for 2 years, or you have end-stage renal disease. Once you become eligible for Medicare, you can also enroll in either a Medigap plan or a Medicare Advantage plan. And if you need additional information in terms of how to go about doing that, please feel free to contact our office. So one of the most important Medicare benefits that you can take advantage of in that Medicare pays for while you are in your own home is durable medical equipment, prosthetics, orthotics, and supplies. This is often called DMEPOS, which is a dumb name, but that's how Medicare refers to it. The types of things that are durable medical equipment are things that can help you with your activities of daily living. So they can provide things like toilet risers. They won't help with grab bars, so they help with equipment itself. They'll help with oxygen. They help with braces and splints. But these are things that will enable you to basically manage in your own home better. They do not do home modifications, which is where things like grab bars come into. If you are on Medicaid, you can get help with modifications, but otherwise any home modifications would be your responsibility. Another way that durable medical equipment can help you is if you are having, say, a long recovery from an illness. So they can provide things like hospital beds. The benefit of things like a hospital bed is that you could reposition yourself. Primarily, we see hospital beds used in the home for things like wound care. So if somebody is fairly close to bedbound, sometimes we can justify a hospital bed. Sometimes we can justify other types of adaptations, if you will, like the egg crate or foam mattresses. Those kinds of things can also be very helpful. Other things that the durable medical equipment can do is that they can provide things like colostomy supplies. If you have had to have a colostomy for some reason or other. Again, using or equipping your home with these kinds of things can help you to continue to live there longer. So Medicare will pay for things like oxygen tanks and hoses, wheelchairs, walkers, some types of canes, braces, splints, ostomy bags, wound supplies, and various kinds of pressure relief devices. It's in Medicare's best interest to basically help you to stay healthy and not to develop any type of pressure wounds or anything like that. So the way that Medicare pays for durable medical equipment is there is a program which was established by Medicare probably somewhere between 10 and 15 years ago. And what Medicare had identified at that point in time is that there was a lot of fraud and abuse in terms of private medical equipment owners, and they would bill for things that people did not receive. So they went to a national competitive bidding system, and they identify one supplier for each type of medical equipment. That supplier then can subcontract with other suppliers in the state. So for example, there is a designated supplier for oxygen for the state of Colorado. There is another designated winning bidder for wheelchairs. And you have to work with an approved supplier or one of their, you have to work with the original supplier who was awarded the contract or one of their subcontractees. It's really important when you are taking advantage of any of these medical supplies or equipment that you make sure and ask the supplier if they are contracted with Medicare. If they are not contracted either directly themselves or through the as a subcontractor, then you could be liable for the cost of that durable medical equipment. This is a very different process, as I said, than those providers that accept assignment. This is primarily physicians and some other types of Medicare providers who basically will accept what Medicare pays as payment in full, and they don't balance bill you over and above what Medicare pays and your 20%. The durable medical equipment does not work that way. If you have a Medicare Advantage plan, it may also pay for additional medical equipment or medical devices. So it could pay for things like glasses or hearing aids or dental care. That is not covered through your regular original Medicare. They're only covered, and most of them is partial coverage, not full coverage. And the coverage really depends. It's not usually available every year. It might be very limited. Say a dental program in a Medicare Advantage might actually only pay for an exam, an x-ray, and a cleaning. Some of the companies do have a more rich benefit and will pay for some additional services, and some will not, similar with hearing aids. Most of the time when you are getting medical equipment, you are actually renting it. Now, sometimes after you have rented it, it will become yours. So for example, if you have a wheelchair that Medicare is providing you and paying for, I believe it's like after either 14 or 15 months, then you own the wheelchair. It becomes yours. But even if it is yours and it needs repairs, then you still have to go through the state approved supplier or one of their subcontractors to get Medicare to pay for the repairs for that wheelchair. In 2020, all of the costs of most of the durable medical equipment is actually paid for by Medicare once you have reached your deductible. In 2021, the deductible is $203. It has not been announced for 2022. In some instances, such as in oxygen, you may have to pay the 20% copay. And then, as I said earlier, if you get your medical equipment from a non-competitive bidding contractor or a subcontractor, then you would be required to pay the full amount. So the next thing I want to talk about a little bit is diabetic care. This is a relatively new coverage for Medicare. Some of it has been around for a while, but some of it has not. So Medicare will cover glucose monitors, they will cover test strips, and they cover lancet devices and lancets. There may be some limits, but Part B will cover those at 80%. You then have to pay the 20% of the Medicare approved amount. So this is one of those situations when it is a Medicare assignment kind of program. And you have to pay the 20% after the Part B deductible is paid. If you have a Medicare supplement or Medicaid, they'll pay the 20%. If you have a Medicare Advantage plan, you may have to pay the 20%. That varies from Medicare Advantage plan to plan. Another diabetic supply that Medicare or that diabetics need in order to be able to administer their insulin is you will need things like syringes and needles and alcohol swabs to be sure that you don't get any infection. You may need gauze, you may need some inhaled insulin devices as well, depending on how brittle your diabetes is and what your doctor has prescribed. Again, there may be a coinsurance or a copayment of 20%, or maybe a coinsurance or a copayment. These are actually determined by your Medicare Part D plan. So this comes under your prescription drug plan, not under your Part B of your medical plan. So Part D, sometimes they can make things available for a $1 or $2 copay, and sometimes you may have to pay as high as 50%, depending on what tier they would put these medical supplies. If you have a Medicare Advantage plan, again, that has a prescription drug benefit, there may be a copay, and that will vary from plan to plan. In addition to that, Medicare now covers insulin. It took us a really long time to get Medicare to actually have insulin as a benefit. They still will only pay for insulin if you inject it with a syringe. They, at this point in time, are not paying for any type of insulin pumps. Insulin is a Part D benefit as well. And so you will have either a coinsurance or a copay, depending on what tier, your Medicare Part D has placed insulin on their formulary. If you have a Medicare Advantage plan, again, there may be a copay. Now, if you are a diabetic, or if you know someone who is a diabetic, in 2020, Medicare implemented something called the Part D Senior Savings Plan or model, which is available to Medicare beneficiaries who need insulin. And what this does is it limits the amount of the copay to $35 for a 30-day supply of insulin. If you do take more than one type of insulin, both of your types of insulin or both vials would be covered. However, if you need more than one vial of the same type of insulin, then the $35 applies to only the first purchase in the month. At this point in time, there are 8 Medicare prescription drug plans that will be offering benefits in 2022, and the majority of them have at least one plan that does participate in the senior savings model. The premiums and deductibles all vary, so it may or may not be in your best interest to review the prescription drug plans that are being offered in Colorado for 2022. If you need assistance with that prescription drug plan review, please feel free to let our office know, and we can help you with that type of counseling. Now, this limit on the out-of-pocket expenses for the copays for insulin should not be confused with the state of Colorado law that says that you only have to pay $100 per month out of pocket for insulin. That is a benefit that is available to Medicaid beneficiaries, and it's also a benefit that is available to people who are in the Affordable Care Act or the exchange, or what some people call Obamacare. That benefit or that law is not applicable at all to Medicare beneficiaries. So Medicare beneficiaries come under the senior savings model, and if you take more than one vial per type of insulin per month, this does not, you have to basically use the senior saver model, not the Colorado law. Other services that Medicare covers in terms of diabetic care is they will cover all types of screening tests. They will cover, and this one is actually free, a diabetic prevention program. A lot of Medicare beneficiaries choose to take advantage of this program because once you have been diagnosed with Medicare or with diabetes, there are a number of things that you can do to really keep your blood sugars under control. And this prevention program that you can enroll in with approved providers can be very, very beneficial to helping you to live a lifestyle that really controls your diabetes. A couple of other things that Medicare will help you pay for if you have diabetes is that they will pay for foot exams once every 6 months if you have peripheral neuropathy and sensation in your feet. So basically, if your feet go to sleep and you don't feel them and you have diabetes, then you can get a foot exam. Similarly, because they want you to be up and out and about and walking around, they will also pay for diabetic shoes and inserts. We know that people who are active are able to keep their diabetes in better control. And we also know that that helps with your overall general health. Another thing that diabetics are entitled to is glaucoma exams every 12 months. Those do need to be done by an ophthalmologist. Again, Medicare will automatically pay 20%. You pay the 20%. If you have a Medicare supplement or Medicaid, they'll pay. And based on if you have the Medicare Advantage, that varies from plan to plan. The one thing that I need you to watch out for when you are purchasing diabetic supplies is where you buy them. So the one thing to know is that many pharmacies, whether they are at King Soopers, whether they are at Safeway, Walmart, most of them or many of them do not have the ability to bill Medicare Part B as in boy. All of them usually are signed up to bill Part D, or prescription drugs. So what gets confusing for people sometimes is when they are looking at purchasing all of the different supplies and equipment as well as the insulin, they will purchase their supplies and equipment at the pharmacy, or say when they're at King Soopers. But King Soopers may not have a Part B provider number to bill Medicare. So then they bill you for the full amount. So it's important that if you're currently paying for all of that out of pocket, to check around and see if you can find a pharmacy in your area that is able to bill Medicare Part B, or if there are other medical suppliers in your area that carry diabetic supplies, and you can purchase from them. We're going to switch now to home health care. Home health care basically is a variety of medical and non-medical services that are usually provided in your home. They can be provided in an assisted living. On very, very, very rare occasion, they might be provided in a nursing home, but most of the time they're actually provided only either in the privacy of your own home or apartment or in an assisted living. The goal here, again, has to be that we are going to delay or avoid nursing home placement. The types of home health care that Medicare will pay for is skilled wound care, and they will pay for a lot of the supplies for wound vac machines, for debridement, all of those kinds of things are paid for. They also can pay for physical, occupational, and speech therapy. And a lot of times people think that you're only eligible for these types of therapies if you have had a crisis. So you've had a stroke, you've had a broken hip, you've had a bad fall. Those are the things that we tend to think of in terms of using therapies. What I want you all to know is that a lot of times, if the individual is having difficulty with like muscle weakness, they're unable to be as mobile as they would like, they're having some speech problems, they're having some swallowing problems, they're choking on their food. Sometimes even we've seen occupational therapy come in with people who have early stage Alzheimer's disease, and they're having trouble remembering where they put things. So these kinds of therapies are also available sometimes. If you have a medical need that is in which an acute situation has become has exacerbated your ability to be independent. So you can get them when you have a crisis situation, or you can get them sometimes when you have a situation or a condition that has become a little bit more exacerbated. So for example, I have a lady right now who is getting some physical therapy because she had to move and she's not as mobile, and they're fearful of her falling. So they are doing physical therapy, as well as they have recently fitted her with a walker. She'll probably get 2 or 3 or 4 visits from the physical therapist, which will help her then to better be able to not only use her walker, but the therapy exercises then will make her stronger, and she'll be more mobile, as well as better able to get in and out of bed. In addition to that, respiratory therapy is also another service that can be provided in the home. This is basically individuals who are suffering from things like pneumonia, from a hospital stay with chronic obstructive lung disease or pulmonary disease, anything to do with the lungs. You might also have a respiratory therapist come to your home and work with you. The one thing that I just realized that's not on here is also infusion therapy. And this can be administered either in the home or in an outpatient setting, but oftentimes is done in the home. Again, if people have like bad infections, sometimes it's done for chemotherapy, sometimes it's done for other types of autoimmune diseases. So those are the kinds of services that you would receive under home health. The non-medical services then that can come with these skilled services are things like assistance with activities of daily living. You can get homemaker services in which somebody can come to your home and help with bathing. They can help with ambulation. They can help with cooking meals. They can help with light housekeeping. They can help with medication reminders. So those are some of the non-medical services that also can be provided. Medicare covers all of these therapies at 100%. The definition of being homebound or needing to receive these is that you have to receive them intermittently or part-time, and the individual has to be deemed homebound. Medicare basically uses the definition that you have to be able to unable to leave your home because it requires a significant amount of effort, or you need a significant amount of help, and your doctor certifies that it is medically necessary. So what you pay, as I said a little bit ago, is Medicare will basically pay 100% of these costs. This is true whether you are in original Medicare with a Medicare supplement, or if you are in a Medicare Advantage plan, assuming that you have met their out-of-pocket limits. And that may or may not be one of the copays that is required to meet your out-of-pocket limit if you're in the Medicare Advantage plan. If for some reason there is a 20% copay, then your Medicare supplement usually will cover that as well. So now we'll turn our attention to hospice. And hospice is basically specialized care for individuals who are terminally ill. Hospice really specializes in keeping you in your own home. The goal of hospice basically is that you stop all treatment, if you will, for improvement or even maintenance of your current condition. And once you elect to go on hospice, what you have basically said is that you acknowledge that you have a terminal condition and that that terminal condition will probably get worse and that you have 6 months or less to live. There are some people who will live more than 6 months. And if your condition continues to deteriorate, hospice can be extended beyond the original 6 months. The kinds of in-home services that hospice frequently provides are they will pay for all of the medications associated with pain management and discomfort. They pay for a skilled nurse to come to your home and monitor your condition. Those visits can be once a week. They could be more frequent depending on your condition. They can also send into your home aides who can help with things like meal preparation, grocery shopping, giving you a bath, getting you in and out of bed, reminding you to take medications. They can do all of those kinds of supports if that is something that's not available through family support. They can provide social work services, which can help you with various kinds of counseling and accessing other kinds of support if you need it. The hospice will cover the cost of all of the durable medical equipment and supplies that may be identified that you need. So if you need a walker, if you need a hospital bed, if you need colostomy supplies, if you need Depends, any of those kinds of things can be covered through the hospice. All of the hospices are also required to have a chaplain, and the chaplain can provide spiritual and emotional support for the patient as well as the family. And usually they will come once a week. Sometimes they'll come more frequently. There are sometimes additional other services that are available, such as visits from volunteers who can also support the family as well as the individual who is receiving the hospice services. The goal of hospice really is to improve quality of life at the end of life and to make it a whole experience. Medicare then covers the following basically in terms of hospice, as we've gone through all of the durable medical equipment, the medical and social work services. They also can cover respite care, which could be a brief inpatient stay to allow the caregivers to have a break. It'll pay for up to 5 days. So sometimes that care can be received in, say, for example, a inpatient nursing care facility, or sometimes a hospice might also have an inpatient facility that they can use for this service. Sometimes it also can pay for services that can come to your home. So if the individual who is receiving hospice services wants to stay at home, they can provide respite services for a couple of days, up to 5. And you as the caregiver then can go on a short vacation or get away. So a question just came up in the chat about palliative care. Palliative care can also now be billed to Medicare. The major difference, though, between palliative care and hospice care is that when you are receiving palliative care, you are still basically either receiving medications and treatment to either improve or maintain your current condition. But it is covered, but it doesn't come with this rich additional benefits that hospice services do. A lot of hospice agencies will provide both palliative care as well as hospice care. And oftentimes people will receive palliative care for things like pain management. They want to get better. They just need support, if you will, to control their pain, or it might be other kinds of services that they are needing. So for hospice care, as I said, it is all paid for pretty much by the hospice. They get a per enrollee fee for every day that you are in the hospice. They do charge, or can charge, up to $5 per prescription for all medications. They also can charge 5% of the Medicare approved amount if you have an inpatient respite stay. If you have a Medicare supplement, usually your Medicare supplement will pay that in the difference, or that 5% on the respite stay. If you continue with your Part D benefit, they may coordinate or may not. Usually I see this as an out-of-pocket expense for the prescriptions that are provided by the hospice. If you may have other benefits as well that can provide coverage, such as long-term care insurance. If you have it, you may have Medicaid. Some charges may also be billable to a Medicare supplement. And if you have a Medicare Advantage plan, they may cover them as well. So those are the major types of services, if you will, that Medicare will pay for you to be able to continue to live in your own home. The Colorado Gerontological Society has a number of tools, if you will, and checklists and guides that can help you when you are looking at ways to stay in your own home. So on our website, we have a screening tool called Help Me Find Services, and it's about 100 questions, and you check off various kinds of information associated with your physical condition, your mental condition, a little bit about your ability to manage in your own home, and those kinds of things. And then based on that, it will make recommendations for you as to whether or not you would want to look at home care as an alternative, or whether you might want to look at assisted living or nursing home as an alternative. We also have 2 checklists. One is called Choosing a Home Health Agency, and the other is Choosing a Hospice. And these are checklists that basically go through some of the things we talked about here, but they also help you to ask relevant questions of those providers, and then can help you to choose whether you want agency A or B or C. So again, it's just kind of getting your mind wrapped around when you're hiring one of those kinds of agencies. What do you need to know to do your due diligence? We also have on our website a checklist for choosing a caregiver. And choosing the caregiver is, again, if for some reason, and a lot of people do this, you know that you need help or services in your own home, and you choose to be able to hire someone privately. So there are a number of questions, again, in terms of doing your due diligence when hiring a caregiver. We also have on our website something called a Housing and Home Care Locator. This is a list of all of the licensed home care agencies, both Class A and Class B, as well as the registries. It also has the licensed nursing homes and assisted livings, the Medicaid licensed adult day programs, and the licensed hospices. At the same location, there are also a listing of the low to moderate income housing units, as well as independent living, if that is a service that you need. Our Colorado Senior Resource Guidebook, we had published every year up until last year. We did not publish in 2020, nor have we published in 2021. Our plan is basically to release something early in 2022. We have had a large number of requests from older adults, as well as our primary distribution method for that book has been libraries over the years. And the libraries, as they have reopened from COVID, have called and wanted additional copies. So we know that it's a pretty well-used a guidebook, and we're happy to make that available. The information on the Housing and Home Care Locator is a searchable database, and it is a duplicate of the information that is in the guidebook. So just because we don't have the hard copy of the guidebook available that we can send to you, you can either yourself or have a friend help you get access to that information through our searchable database online. Other places that you can find services are local newspapers. Oftentimes will have ads, or they might have little inserts in their papers. They may have some editorial, really depends. Word of mouth continues to be a really good way to find resources and services as well. There are always lots of directories that various groups are printing. Often those are available through libraries, senior centers, and other programs like that. Senior fairs are starting to be another resource that is coming back. We at the Gerontological Society are not participating in any of those at this time, but we have participated in many of them over the course of years. So our services and information is available. If anybody is interested in any information about the various programs that you might pick up at any of our senior at a senior fair, please feel to put your name, address, and telephone number. Give us an email at cogs@senioranswers.org, and we're happy to mail you a packet of information. We also have both placement and referral agencies as well as care management agencies. Placement and referral agencies tend to have contracts, usually with assisted living and nursing homes, although sometimes they will have a contract with home care agencies as well. And they then will help you find a provider if you choose to have them do that legwork. Care management agencies work usually on a fee, and they will basically not only help you with placement kinds of services, but they can help you with getting care into your home. They can help you with getting to and from the doctor, picking up prescriptions. So depending on how robust the care management agency is, there's a variety of additional services that they can help you access. You pay them a fee, and then they help you access those services. There are also lots of community-based organizations that can provide usually information and referral. The internet is another source where you can find information. Next door apps Sometimes those are very useful. People oftentimes are very honest, if you will, in terms of their experience with a vendor. So if they have had a good experience with a home care agency or a hospice or durable medical equipment place, they may actually post that. And sometimes that kind of a reference is as good as anything else that you can get. Most agencies at this point in time also have a presence, if you will, on the web. And so you should be able to find information that way. It's probably nothing that can take the place of, though, a in-person visit. This is basically the Help Me Find Services screening tool. And I apologize that the link over on the right-hand side got very blue. Before I send out the slides, I will turn that to white so that it will be easier for you to be able to link to that form on our website if you are searching for help for a loved one. This is our most recent copy of the Senior Resource Guidebook. We do have a few copies available. If anybody is interested in having one, we certainly will make them available. Just know that the data was collected in 2019. So things like pricing information are probably somewhat outdated. But if you understand that, the information is a couple years old, we're happy to provide it to you. And the link on the right back there was to be able to order one online. Our next session in this series is on home modifications that can help you to stay in your own home. That will be on November the 18th. We'll be sending out the Zoom link for that as well. You can also go on our website at senioranswers.org and you can sign up in advance. You will get a email confirmation after you register, which will give you the information to be able to sign in to the meeting. If for some reason or other you're unable to sign in online and you need to call in, this is the call-in number along with the meeting ID and passcode. And that brings this session to a close.